It's quite simple to set up an intravenous line, but there are a few tips that can make the job easier. The intravenous fluid hangs at the bedside. Remove the protective cap on the sharp end of the tubing and insert it into the opening, being careful not to penetrate the side of the bag. With the tubing occluded in the roller clamp, squeeze till this chamber is half full. Then, unroll the roller clamp, making sure to protect the distal end of the tubing and to keep it lower than the chamber. Flush the tubing, vibrating the line gently to drive bubbles along the line and safely out. This vein on the dorsal surface of the hand is the usual choice for the IV line. Prep the skin with alcohol or betadine. A little traction on the skin, a shallow approach to the vein, and the slight flashback into the needle shows that you're in. You apply a little pressure to the puncture site to control any bleed back before attaching the line. The distal end of the tubing screws firmly into place. Hold the catheter in place while you check the tubing to ensure flow. And protect the insertion site. The intravenous line insertion can be uncomfortable for some patients. If time allows, you can numb this delicate area with a subdermal application of lidocaine. You will inject just beside, not into the vein, and just below the surface of the skin. As it infiltrates, you'll see a wheal being created, a small protrusion, just enough to numb a small zone around the puncture site.